Okay, this is Chapter 8, Understanding and Meeting the Healthcare Needs of Students with Severe Disabilities. And this is the 8th edition of the book, so it may be a different chapter in another book. Or, chapter in another edition of the book. Okay, so learner outcomes for this chapter as it relates to students with complex or special healthcare needs is identify the types of healthcare procedures needed by some in the schools. Describe essential knowledge to assure safe care. Describe the roles and responsibilities of key personnel. Describe critical role of communication, especially in the coordination of care. And describe inclusive practices. So, introduction. School attendance of students with special or complex healthcare needs is relatively new. Why is this so? Because students are living longer due to improved survival rates, increased inclusion of schools with multiple support needs in the public schools, and portability of medical equipment beyond a traditional hospital clinic setting. Their attendance of these students requires specialized consideration. So, number one, their safety. Second, their specialized care. And then, of course, focus on them as students, not as patients, and then collaboration and communication with other professionals in the field. So who are students with special healthcare needs? One definition is those who have or are at increased risk for a chronic physical, developmental, or emotional condition, and who also require health and related services of a type or amount beyond that required by children generally. That's a good broad definition from McPherson et al. 1998. Includes students in need of medical technologies with asthma, diabetes, epilepsy, etc. So it can include a whole range of healthcare conditions. So, with regard to terminology, the terminology that's in vogue or used mainly now is student with special health care needs, but you also hear the word complex in lieu of special. The term medically fragile is not used as often because it does have a negative connotation of that the child is fragile and not resilient, and that you have to handle the kid with kid gloves, and that is off-putting and scary at times. So that term is used less, but you still certainly hear it though. Students with special healthcare needs incidence. So there is no definitive count, but it reported to be increasing. And this is all data from the National Survey of Children with Special Healthcare Needs. So I've done a couple studies with this data, and it's produced by CAMME, which is Child and Adolescent Health Measurement Initiative, and the Maternal and Child Health Bureau. You can download this data. It's very accessible. So it seems to be increasing, but the definition is purposely broad. So it includes students with asthma and allergies, etc. So it is a very broad definition. General healthcare must-knows. Hygienic care providing, and then as well as basic care and emergency procedures. So what is hygienic care providing? It's the obvious: hand washing, disinfection, and waste disposal. So just, to prevent the transmission of disease and infections from one person to another. So hand washing, basic steps. I don't think I need to go over this, but wet, lather, scrub, rinse, dry. A disinfection, routine cleaning of toys, manipulatives, table surfaces, eating and feeding supplies. Waste disposal, if you have a student who needs a diaper or other changing materials, careful disposal of those. And also a hands-free container to cover openers. For allergy control, the sources of problems generally are food, so wheat, nuts, air, which may be seasonal in terms of pollen, and then classroom animals, as well as materials like latex gloves and balloons. So those are the common things to look out for. For basic care and emergency preparedness, there's basic first aid as well as seizure management. So for basic first aid, the basic knowledge of procedures and availability of necessary supplies. So make sure that you have some basic understanding of first aid. For seizure management, it's important to know the knowledge of types, the knowledge of student needs, and the knowledge of appropriate responses to seizures, those routine and not. So here's some do's and don'ts of seizure management. Do's, stay with the student, know the duration of the seizure, so record keeping is important here. Reassure the student, minimize risk by clearing the area as you can. So to block falls, remove hard objects and sharp objects, cushion the head, remove glasses, check respiration, and turn student to the side to minimize risk of aspiration, as well as providing privacy as much as you can. Some don'ts: don't leave the student unattended. Don't move the student unless necessary. It's better to move things out of the student's way than to move the student. Don't restrict movements. Don't attempt to forcibly open the mouth. I know that used to be some advice to put something in the mouth, but don't place anything in the mouth. Don't grab the tongue, and don't provide food or drink during seizure. So those are some do's and don'ts of seizure management. Emergency care. When should you do it for seizure management? Well, when duration is longer than typical. So that's where the record keeping becomes helpful, especially if it's a substitute or an aid, or just because you're so busy you don't really recall, well, how long is it typically? So a record keeping of that is particularly helpful. Difficulty with respiration, difficulty breathing, consciousness not regained after a seizure. That's particularly troublesome. Seizures that occur in rapid succession. And then, of course, injury that occurs during a seizure. So there's a bunch of specialized healthcare procedures that you may want to be familiar with. CIC, shunt monitoring, nebulizer treatment, tube feeding, I always have trouble with this word, tracheostomy care, and ventilator monitoring. And that will be as related to the specific student and their healthcare needs. In the coordination of care, communication is key. So to have an individualized healthcare plan for the student, as well as careful record keeping, especially when you're talking about seizure management. Individualized healthcare plans. So a description. What do those include? What is included in that? A description of the student's health history, a description of the student's specific healthcare needs of the child, a description of the child's current healthcare status, a description of the child's medications that they've been using, and a description of the medication, so possible side effects may want to be included, and a clear specification of which school personnel will be administering and responsible for administering medications. Also, a description of special dietary and nutritional needs of the students, any specialized transportation needs, a listing of specialized equipment, and a description of what constitutes an emergency and what procedures should be followed when emergency occurs. So there is such a thing as child-specific emergency plans. So with careful record keeping, it's not only just about recording seizure events. It's also about training documentation, such as CPR, etc., and medication administration reactions. So, inclusion. In the inclusion of students with special healthcare needs, it's important to encourage, acceptance by peers, which is a function of acceptance by school personnel. So you model that behavior for students. Specialized educational content, learning to administer direct own care, so you're teaching life skills for that student, as well as maximizing educational opportunities by combining care with instruction. So summary, students with special healthcare needs have complex needs. They require consideration of both unique educational and care needs, and specialized training for all, and competence-based training for some. So these students require careful delineation of plans, communication of those plans, and documentation and implementation of those plans. Result is you focus on this child as a student and not as a patient. You're acknowledging their patient role, but you focus on them as a student. Okay, well that's chapter 8, and see you for the next chapter.